So we look at the concept of essential drug list. So for the essential drug list, it's just more like the drugs that are to always be available, okay, to a particular population, because what the drugs can be used to handle some common medical issues that they suffer from. Do you understand? So we'll look at the list and we'll just look at some drugs. Now this is just a general list. You should know that what every country, this is like the original list. Do you understand? So every country kind of like modifies this list, probably adding more. Most of the times adding more, okay, as related to the disease conditions that worry them the most in that particular country. Do you understand? So essential drug list, we say that it's a selection of medicines, and this is considered that you're actually selecting a medicine that is the most appropriate to addressing what the health issues in that particular population. So it's based on the World Health Organization model of list of essential medicines, which is usually updated every 2 years, and it guides countries in creating their own national list. So countries take the one that World Health Organization does and they modify it, they work on it. Most of the times, of course, the cases they are adding more. So World Health Organization was the list was that's the essential medicine list, was first published in 1977 rather, sorry. So we have the latest edition, which was in 2025. So I'm recording this video in 2026 though. So it identifies what medicines that are safe, that are very effective and cost effective, and this actually ensures that the medicines are available in adequate amount, okay, just what is needed. So many countries, including I'm talking to you from Nigeria, so they also have developed all those their national essential drug list. So what's the structure? You have the core list. These ones are medicines that address the most common and important health needs, okay. Then we have the complementary list, okay. So these are medicines for specialized care, okay, requiring additional facilities, additional training, additional monitoring. You understand? So let's look at some of them. So we have over 600 drugs. Do you understand? So we're only looking at some. All right. If anybody here wants to look at the in-depth list, I've actually covered it in one of my pharmacology YouTube channel like that. If you want to look at the full list of the 600, you could drop a comment and I'll drop you the link. So we have antibiotics like amoxicillin, ciprofloxacin. We have pain relievers and anti-inflammatory drugs like paracetamol, ibuprofen. If you notice, these are the drugs that you always see, they're very common in the pharmacy. So we have antimalarials like the artemisinin-based combinations. We have vaccines and immunologicals. We have cardiovascular disease, all those antihypertensives like atenolol. We have diabetes medicines like all those insulins and metformin. Then we have cancer medicines on the list too. Okay, there are different types, The psychiatric drugs like all those fluoxetine and haloperidol. So why does this concept of essential medicine matter? It matters because it now guides how those drugs are supplied to public health systems, and it also promotes that patients know that okay, this drug is available, so if I'm sick, I'll go and get some advice so that I'll know which of them is the best for me. You understand? So it focuses on enhancing health, seeking behaviors. Improves equity because it makes the drug available for all, regardless of if the person is poor or rich. So it also supports sustainability by preventing waste. So you just spend on what you know that a particular population will need.